Hey, good morning, everybody. It's Dr. McDade from McDade Family Chiropractic here in Rochester, New York, and I just wanted to take a few minutes between patients to discuss a really cool pilot case series that was reported just a few months ago in the Journal of Chiropractic, Chiropractic Journal of Australia, in September 2012. And it's a pilot case series, pediatric chiropractic and infants with difficulty breastfeeding. It's a case series of 19 children that were having a hard time breastfeeding, and we all know breastfeeding is so important for the normal development of the immune system as well as other neurologic factors and of a child, of a newborn. And so if a child's having a hard time breastfeeding, it's really important that we do everything that we can through consulting with lactation consultants, as well as looking for any mechanical stress through a chiropractic evaluation to make sure that these kids are able to develop the skill to be able to breastfeed comfortably and efficiently so that they can help their mom produce milk and do all those other things. So the case series was an evaluation of 19 kids to determine if any common subluxation patterns could be found in these kids that would maybe interfere with their ability to breastfeed normally. And there was two actual areas that they found that a lot of these kids had in common. First was the upper neck, the atlas, and C1 and C2 region of the upper neck, as well as the clavicle or collarbone region on these kids. And you might be asking yourself, how can chiropractic care help a child that's having a hard time breastfeeding? And really, when we start to look at this research, there's a couple of different ways that we could think about it. One is just the mechanical issue. You know, through the birthing process, it's not uncommon for children to sustain some type of injury to their shoulder girdle, through the upper neck region or some part of the spine, and potentially even through the cranial bones, which can affect the TMJ, which would make it potentially painful for them to try to turn their neck to one side or the other, where you can imagine if you ever had neck pain, that pinching can really stop you from wanting to turn one way or the other, or restricted movement if there is any type of subluxation or misalignment of the collarbone, and or the TMJ. If you're trying to move your TMJ, if you've ever had a painful TMJ problem, you can understand how painful that could be. So just that strict mechanical issue where there's a vertebrae locked out of position causing pressure on the disc or the joints, or even the soft tissues of these children might be inflamed, could really impact their ability to want to breastfeed because of the pain. And the second is more of a neurologic complication or a neurologic factor. The cranial nerves, or the nerves that come out of the lower part of the brain that help to control the tongue movement, the muscles in the tongue, they pass out of your skull, and they pass through portions of your upper cervical spine and carry branches not only from vertebrae of your upper neck, but also of the coverings of your spinal cord. So if there's any type of misalignment of the vertebrae, there's the potential that it could be stretching or compressing these nerves, which could alter nerve flow, which could, if you think about it, if you take the nerve that goes to your arm and you cut that nerve, what happens to that body part? It stops moving. You can't move it. Now, if you don't cut it, but you damage it in some way, you can imagine how it might affect the ability for you to move your arm or have stamina or strength in your arm. Same thing with these kids with the tongue. They need a lot of coordination through certain parts of their brain, and if the nerve is stretched, it could alter the ability for them to move their tongue, which could result in tongue tie, the inability to latch on, and several other factors that could impact their ability to breastfeed. So by aligning the neck, you are potentially helping to take the pain out of those joints in the TMJ, as well as get the range of motion through adjusting the clavicle if it needs to be adjusted, or the upper rib cage, and also helping these kids, most importantly, have a strong neurologic connection between their brain and the nerves that control the muscle movement of their tongue. So I hope you found this review of the research helpful. If you have any questions, feel free to drop us a comment, either by leaving a comment here under the video, or you could always give us a call at our office at 585-241-9990. You can check out the website. This will be listed on our website at drmarcmcdade.com. That's www.drmarcmcdade.com. And look under our blog posts for this. Or send us an email at drmarc, M-A-R-C, drmarc at drmarcmcdade.com. All right, guys, have a great day. Look forward to another research review and update soon. Take care.